Hello guys, I'm Daria from Artezio technology company, and today we're going to talk about telemedicine field. Now, first of all, remember to hit likes and subscribes, and be aware that this is the first part of videos from Artezio devoted to telemedicine. There would be a second part on telehealth, so don't miss it. Telemedicine is a medical field based on the use of modern technologies and ways of communication to provide remote medical care and doctor's help. It doesn't belong to any particular medical field, however, it can be successfully used for various needs, therapeutic and surgical, equally successful. Here are some simple examples of how telemedicine can be beneficial. First of all, it can be used to conduct research based on the data gathered in another clinic without actually sending your medical personnel over to another hospital. Secondly, it can be used during the surgical interventions for telementoring and help of professionals and high-level surgeons, regardless of in which part of the world they are during the surgery. And thirdly, it can be used for telementoring and teaching students remotely without taking the doctors away from taking care of the patients in order to take care about their students. The objective of telehealth are logically related to a number of benefits this technology can provide. In some cases, significant remoteness of the majority of people from some medical main centers and hospitals can be a very serious issue, which telehealth can solve. It takes off your plate the need to travel to some major point or known hospital in order to get diagnosed. The gradual expansion of outpatient and inpatient medical services that can be provided without taking people away from their houses. Telehealth also provides direct access of patients to the doctors and specialists they need, without any waiting lines and long registration processes. More importantly, telehealth provides the ability to monitor certain diseases round the clock, without interrupting the patient from his or her daily life. Telemedicine also reduces the cost of medical services and covers the lack of medical personnel. Among other things, telemedicine largely simplifies the receipt of medical care and allows doctors to track many patients at once, saving them a lot of time. The popularity of self-medication should be reduced with telehealth technology, because the only reason that self-medication is used for is that patients often neglect the necessity to see a doctor for the right diagnosis and prescriptions, just because it takes a lot of time to get to the doctor, pass through the line, and get diagnosed. Telehealth take this off, because the only thing that the patient would need is just to sit in front of their computer, put on a webcam, and talk directly to the specialist that could help. However, self-medication without any help from a professional doctor can lead to sad results. And there are three main reasons for that to happen. First, you often need to combine several types of medication to treat the disease. Second, it's important to take certain medication within a specific period of time for them to be effective. And third, the dosage of any drugs or medications you're taking should be overseen by a doctor to be effective and not hurting your health. With the use of telehealth technology, those risks are reduced but not completely taken off your plate, because you get some help from a doctor, but a doctor doesn't actually see you and doesn't have a possibility to get the analysis for precise diseases. Therefore, online consultation is kind of a panacea used by people who don't want to spend many time to get to an actual doctor. However, it opens a possibility to see a physician or a therapist on a regular visit in a very convenient form like chat or Skype meeting to get prescription, general advice, or a new regimen to follow. What do you know of types of services in telemedicine? Share your knowledge in comments, or if you want to get such knowledge, remember to subscribe, hit the bell, and see our next video where we are going to discuss this topic, types of telemedicine services. See you later!